Hello, everybody. We have a lot to talk about, and joining me now is Akram, President and CEO of the MetroHealth system. Thank you so much for being with us. A lot going on today. Governor DeWine just announced that he's closing bars and restaurants and a number of other things. Of course, they'll still be able to do drive-through service. These are what you would consider mitigation efforts. What's the difference between mitigation and containment? And is this indeed what we're in?
Yeah, so containment is when you have early cases, you're tracing them, you're making sure that the people who are in contact with that individual are also isolating. Mitigation is when you believe there's widespread community infection, and then the way you want to do that is now reduce the peak of that community infection. So that is mitigation strategy.
Have we done this in time?
Oh, absolutely. I think we have. The data demonstrates that every day early you can do mitigation strategy, you could reduce the peak by 40%. So a couple of days difference can make a significant reduction in the peak. So here's what I would say. The early closure of schools was an excellent decision by the governor. This other decision, which is now really codify social distancing, and we should talk more about that and what businesses should do, what MetroHealth is doing as both a provider and a business to make sure that social distancing takes place. I think he's making the decisions with the necessary information as early as humanly possible.
You know, we've seen so many, the ball got rolling, all the sports teams got involved, everybody, and what people may not understand is that this is, sure, this is hoping to stop the virus, but there's a much bigger picture, and it involves hospitals like Metro, and the bigger picture is to prevent this from overwhelming our medical systems. Can you explain why?
Sure. So it's clear that this is the only thing that we can compare this to in our lifetime is the 1918 pandemic flu. Influenza issue. So why is that comparable? One is we didn't have any treatment at that point in time. So very similar to coronavirus today, where we only have supportive treatment. So the 1918 pandemic flu. What was demonstrated is that, for example, St. Louis began doing measures exactly like we're doing today very early on. Their peak was 80% lower than Philadelphia, that did it much later in the cycle. So every day counts here, and we can reduce the peak. If we reduce the peak, we flatten the curve, we don't overwhelm the healthcare system. We can then have enough supplies to be able to take care of people appropriately, enough respirators, enough medication, and enough personnel.
And we're also seeing, that's what's known as flattening the curve.
Correct.
So we're seeing that now around the world as well with coronavirus, because some countries have already done that, and these were mainly the countries that were hit hard with SARS in the early 2000s. Taiwan, for example.
Right.
And so when you see some of these countries are learning from past experience, did we learn in time?
You know, I don't know if we thought we were immune. So again, closing borders and all of that may have been a little bit later than we should have done them. But I think our reflexive response is much faster than it would have been before SARS. So if you look at Wuhan, you see there's been kind of an 8-day delay from when they put in measures to when the numbers of cases began to come down. Maybe 14, the maximum. So what we know is that the average person is asymptomatic for about 2 to 14 days after exposure, with the average time being about 5 days. So after you get exposed to coronavirus, you don't show symptoms. Most people don't show symptoms until the 5th day. So they become, and so that means with 36 cases in Ohio today, probably the likelihood is that number is maybe 10 times that right now. It could be even higher, but you're going to see those numbers escalate significantly over the next few days.
So during those 5 days where they're not showing any symptoms, they're still contagious and they're still infecting other people? Is that what you're saying?
Correct. So that is why we talk about social distancing. So as the virus replicates in your body, that viral load that you have the first day increases the second day, third day, fourth day, fifth day. It is only when it impacts you, begins to overwhelm your body, you start showing symptoms. You start showing the coughing, the shortness of breath, the fever. When it's a small amount, you're just feeling a little bad. It's not terrible. So that is why social distancing is so important. You and I are sitting 3 feet apart. It's because you're not showing any symptoms, I'm not showing any symptoms. If you were coughing or I was coughing, we would sit 6 feet apart.
And why is that?
That is because coronavirus is primarily transmitted through droplets. And droplets are things that happen when we speak. We produce them when we speak, we produce them when we sneeze, and we produce them when we cough. So they can go up to 6 feet. So if you're far away from me, 6 feet, if I'm feeling sick, you're fairly safe.
And so that's really important because SARS was airborne.
Yes.
And this is droplet contamination. So you literally have to be coughed on or in such close proximity that the droplets have to be able to get
Or if
within.
the droplets get on your paper, and then you touch your paper with your hand, and then take your hand and touch your eyes, nose, or mouth, that's how it gets transferred.
Which is why we keep saying wash your hands, wash your hands, wash your hands, and don't touch your face.
Correct. And people today are relying a little bit too much on hand sanitizers and Purell. They're good second choice. They're not the primary choice. Primary choice is you wash your hands for 20 seconds with soap and water. That is the best choice. We have almost endless supply of soap and water, so try to do that. And by the way, when you cough into a tissue or your sleeve, remember to wash your hands afterwards.
A lot of people are concerned relating to, they want to be tested. They think maybe they have these symptoms. And one of the biggest populations are those people who may not have insurance or they may be underinsured. What do you tell those people if they think they may have been exposed or maybe they have symptoms and they want to be tested?
Okay. So for the vast majority of individuals who have low to moderate symptoms, we are not testing anybody. We don't have enough tests to be able to do that. There are limitations on reagents and also actually the medium that we put the swabs in. So most people are not getting tested unless they've had an exposure. And we know that it's a definitive exposure and we want to rule them out. So but people with mild and moderate symptoms are not getting tested. We are saving the tests for patients who are in the hospital and who are also critically ill, right? We want to be able to do that. So I would say this, we started a telephone line about 3 days ago, or two and a half days ago, and it's 1-440-59-COVID, COVID. We have so far had in 2 days, have had over 500 calls to the center, another 350 calls to the nursing triage line, and our doctors have done about 150 virtual visits. We've diagnosed many patients with both the flu, colds, and we think some have COVID-19. So we quarantined these people, and we've done it over the phone.
So mainly if your symptoms are not that bad and you're not having breathing difficulty, the only answer you're going to get is stay home and quarantine yourself.
So this is critically important. The best thing you can do for yourself and others if you do not have chest pain, shortness of breath, or other severe symptoms is to stay home. If you do have shortness of breath, chest pain, or other severe symptoms, you should seek medical attention, but call first. call your doctor, call the emergency room so that we can meet you, put a mask on you, and make sure that our healthcare workers are not exposed and that we got you in the right room to take care of you.
And we're calling this a civic duty at this point, you know, that this is everyone's responsibility. Why do people really need to take this seriously?
Because you're going to save your family and friends and co-workers if you do this right. If you don't, it is having a loaded gun and just going around and discriminately exposing people to it. So it's one of those things that we should have been doing with the flu. This hopefully will help us change our practices. If you look at Japan, for example, they wear surgical masks not to not be infected by other people. It is done as a courtesy to other people. So people wear surgical masks when they believe they have a cold and they don't want to get others infected.
And the other thing, you know, talking about overwhelming the healthcare system, I think a lot of people don't realize that if this happens to the extent what's happening in Italy right now, that affects anybody who may be in a car accident or have a heart attack or anything else and needs a hospital.
That is true, but it also creates uncontrolled spread. When healthcare workers become sick, we can't take care of other people. So we won't be able to man the lines, we will not be at the telephone lines, we won't be able to provide treatment. So if the healthcare systems get overwhelmed, what you will see is widespread community of the epidemic. That is why at MetroHealth we've taken some very serious measures. The first is that we are limiting visitation. You have to be screened. You cannot come into the organization without getting a screen. Second, we've limited the amount and the people who can visit loved ones. We now have moved to no visitations to our ICUs unless there's a doctor's order for it. We have moved now to virtual visits that people can talk to either to the nurse, the doctor, or to the loved one. So we are also beginning to eliminate to postpone most of our surgeries, most of our procedures, and most of our interventions. If they can be pushed back, we're pushing them back. We're converting most of our well visits and also sick calls into virtual visits so that we're doing this through telephonic means with patients. So we're going to use the technology so that we can still provide care and keep everybody else safe.
What's your advice to other businesses?
So beginning Tuesday, which is the earliest we can do at the MetroHealth system, we have identified employees who can work from home and are not going to impact the way we're taking care of people. You know, we think that could be several thousand people in our organization. We will make sure they have the right equipment and right opportunities to continue providing services to us. My advice to other businesses is do the same thing as quickly as possible.
You sent me an article that was very interesting, and I'm going to link it to our WKYC.com where this is posted. One day between, you know, mitigating circumstances, one day between, you know, making changes one day to the next. What's the difference? So
it's 40% of the peak. So that is truly flattening the curve. So Dr. Amy Acton keeps talking about the numbers that we think we have or we can get to. And she keeps saying, and not a lot of people are listening to that, which is that if we do these measures, we will flatten the curve significantly. As I said, 1918 pandemic flu, cities that did it early, a couple of weeks apart, had an 80% reduction in the peak. That is how big it is. You eliminate 4 out of the 5 people that are going to be infected.
And I bring this up again because St. Patrick's Day is Tuesday.
Yes.
And a lot of people, even though now bars are closed and restaurants are closed, a lot of people are still going to want to get together, and we're trying to tell people this is that serious that we want you to be around for the next St. Patrick's Day.
Yeah, celebrate with your immediate family in your house, but if they are showing symptoms, they have to get isolated too. So even in your own family, you have to be able to stay 6 feet away from somebody who has symptoms.
There's been a lot of fear. And one of the things that I've had a lot of people ask me about, they're very concerned. We've seen the run on toilet paper and the run on water. And, and then we hear these numbers that are coming out about the fatality rate with coronavirus compared to the flu. And on Saturday, the governor mentioned that coronavirus is 20 times more deadly than seasonal influenza. Can you clarify, what is he referring to and what population is he referring to?
So we are looking at patients who have chronic diseases, those who have significant heart conditions, those who have significant pulmonary conditions, those who are immunocompromised with cancer and the like. So, for example, coronavirus for 0 to 9-year-olds is much better than the flu. They don't seem to get as sick, and they've had very few deaths reported in 0 to 9-year-olds. So, but those who are sicker, who are more vulnerable, my mom and dad, who are 92 and 96, are significantly more vulnerable to coronavirus than influenza.
And that's what's so important for people to understand, that 80% of these cases may be mild, but for those over 60 and those over 80, this is incredibly dangerous.
I think we will find out as we are finding out in China, and in places that they're beginning to do widespread testing, that it's actually more prevalent than we think it is, and it's less deadly than we think it is. So if you count all the cases, people who are almost completely asymptomatic, if you test them, you're going to find out that if you do things right, we should be able to, as the article shows, we can get to about a 1% mortality rate. If you don't, we can hover between 3 and 5% mortality rate for all cases, the asymptomatic ones and the symptomatic ones.
But it's concerning for areas that have an older population, and that's what people need to bear in mind.
Right, so visiting grandma is not a great idea. Checking on grandma is an excellent idea. Providing her with lots of different things to support her is good. But actually visiting grandma when you're sick and when you're not feeling well is not a great idea.
Well, we understand that senior daycares and senior centers are likely to close, and I know we don't really have an answer for this right now, but for those seniors that really don't have family, but they may have neighbors, is there anything people can do to help them?
Yeah, of course. Check on them, speak to them, call them, ask them what their needs are. You can even provide food for them. For example, our Institute for Hope at MetroHealth has been collecting names of people who want to help others, and we are directing them to the Red Cross, to the Greater Cleveland Food Bank to help those who are in need. We'll bring them medication, we'll bring them food, and you can do that if they are able to get to their door. You can deliver it and then call them and say, it's at your door. They can go and get it themselves. And those who need help, then we will help them. We will go there with trained personnel, with gloves and masks, and to make sure they're safe. Not to make sure we're safe, but to make sure they're safe.
How long do you think this is going to last?
There's really no way to know. So the more you flatten the curve, the longer it lasts, right? So that's really the important thing. The way we will find out when this is going to, when it's going to end is when actually the number of cases go down. Today we're on an upswing, and you're going to see significant increases in those number of cases. Even though in Wuhan, as it showed, even though the mitigation strategy was working, still the number of cases went up for about 8 or 9 days afterwards, and then they finally started coming down.
So we can see the cases increase, then hopefully we'll see them go down. But we still need to continue social distancing for some time after that happens, correct?
Absolutely. I think that period of time we're going to have social distancing also is going to depend on the temperature, and because I think we're at a period of time right now, the colder it is, the more we're likely to have the virus transmitted. So these types of viruses can either have a single peak, which is a winter month peak, or can they have double peak? We're not sure this one, so this could have another peak in, say, in August. So we will have to watch how it plays out in China.
And typically they don't, it's not like seasonal flu where it goes away in the summer. This is typically a virus that just sort of hangs out.
Well, it becomes significantly lower and then can have another peak.
And until we have a vaccine, is it likely that we're going to see more cases next cold and flu season?
Honestly, that is very difficult to say. We are very early in this to make predictions like that. But the important thing is to note is that there are multiple organizations working on vaccines. We have capabilities to produce them much faster today than we did a few years ago because of the genomics analysis that we understand. There are also several promising drugs that people are thinking about utilizing for this. The terrible thing I would say is that people who think that they're using nasal zinc to reduce their chances, and it makes them touch their face even more. So just people shouldn't do that. And they should adhere to the advice that is coming from the CDC, from the governor, from our Department of Health and our healthcare professionals, which are really, if it's okay, I would like to go through them again. So if you can work from home and your organization can help you do that, please do that. Second is if you're sick with symptoms of the cold and flu, stay home, take care of yourself and your family with over-the-counter medication. If you have severe symptoms, call your doctor if you can before you seek medical attention. Stand 6 feet away from people who are feeling sick and at least 3 feet from everyone else. For those at high risk, you should social distance as much as humanly possible. Wash your hands with soap and water for 20 seconds at least. That is the best way to keep yourself from getting infected, and utilize hand sanitizer as a second option. Don't touch your eyes, nose, or mouth. I know how difficult it is. If you do, get a tissue and touch it with that, and cough into your elbow or tissue, then wash your hands.
One of the things that came out on Saturday was the French health minister was telling people in France not to use ibuprofen to bring down a fever. And that confused a lot of people. The belief was that it may impact your immunity relating to coronavirus. Is there any truth to that?
So, you know, we typically don't change how we provide healthcare in the medical community based on a tweet. We don't know what the evidence is today, so we have lots of scientists who are looking into it to understand what he's talking about. But as of today, we're not changing the way we take care of people based on that single tweet.
So fever reducers, most people reach for acetaminophen anyway, so that's, you know, the standard
Aspirin,
thing.
Tylenol, you know, when you have flu-like symptoms, a lot of people use Motrin and Advil because of the muscle aches and pains. So we have not changed how we do that right now. If we find out that there's evidence that weakens the immune system, we actually will tell the public that, and we'll update our discussion with you.
And bottom line, there's no need for fear. Yes, this is a crazy time, but there's no need for fear at this time.
So I would say there's no need for panic. There's the best way is to put all of our energies into protecting ourselves and our loved ones. If you don't get sick, you can't get anybody else sick. That is really where our energy should be.
All right, Dr. Boutros, thank you so much.
It's my pleasure.